animals? I'll put my stuff down. You'll be fine. No, you're fine. Not that mistakes, but it was
Remember the chairs,
All right, guys, calling our June 18th meeting to order. Gonna accept the May 28th minutes. As far as any,
everybody has to.
oh, they all have to, I'm so sorry.
All right.
All right, for updates, it's gonna be a very quick meeting tonight, mainly because we have the retreat next month. There's really not much to go over for anything right now. We'll do a lot in July, so that's my updates.
Come out tomorrow, from about 2 to 7, maybe 7:30, Juneteenth, celebration. I know we have some volunteers here, so we look forward to, our last event in the month of June. Thank you all for, joining us on this busy month. We really appreciate your time and efforts.
So we don't have anything to do with Fest at all?
No,
Okay, the Juneteenth is at 2?
no, that's what time we'll probably get here to set up.
Okay.
The event is from 3 to 7.
Okay.
If you all are volunteer. Yes, let's say about 2:30, for you all. Is that a good time for them to come help us set up 2:30?
Mm-hmm.
Yes.
Which shirts do I have?
And they're in the office.
Yes, we'll have your shirts for tomorrow. They're in the
It's
office.
been one of those spells.
No, it's fine. Are you gonna? Well, we'll get, yeah, we'll get to that. Okay.
Other than that, do we have any other updates? Nope, that is all.
Okay.
You mean for the meeting?
No, from our department.
We just don't be Christmas
So do you want us to come here at 2 or to City Hall?
Meet us at City Hall
At 2.
at 2.
Okay.
Or 2:30. Let's say 2:30. Give you 30-minute grace.
Are there going to be any, I guess we'll talk about it in whole business.
That's y'all's updates.
Yes, that's our updates.
Okay, public comment on old business. No. All right, so we're gonna start on the old business. So for the Juneteenth tabling, I really just wanted to get a rundown of like how many people are coming to table and pretty much what y'all kind of already just went over. But do we know how many? People
I
are
think
taking?
per year, in terms of HRC, I think I have 4 people signed up. I think I sent the stuff. I think I have 4 people signed up, and then there'll be 4 of us.
Okay. And you've got me in my one.
I was gonna ask if there are any new goodies for the table, because I've collected so many of the stuff that we've had for the last few months. We still got by and grab some more free stuff.
It's very good to be my age, then to get rid of everything.
We're getting rid of everything that you already have. Right now, I think we're down to sunglasses and water bottles. And, at the retreat, we can discuss, so that might be something that you all may want to start looking into. What
That's a
you
good
would like
idea.
to see in terms of swag items moving forward. So, we won't select them for you anymore. We'll allow you all to select what you want, give you a list of vendors to choose from. And then, once you guys narrow down what you think is good for you all, I'll submit an order and get those things ordered for you.
Do you have something for us to do that? Is there a magazine or?
I'll send you, an email with I'll have everything basically at the retreat, all of the websites that, you all could discuss and look at, the top vendors that we use.
Okay, when and where is the retreat?
We're gonna get to that. Yep. Anybody else have any like questions or concerns about tomorrow's paper? Okay, on to the next thing. I wanted us to review what we've already tabled, which was Hot Corner. That was this past weekend, and the weekend before that was Pride. So for everyone who went to Pride, like, how did it go?
I guess I'll go right, yeah. Are
Lots of
we,
people coming past the table.
yeah, there's a lot of people, which is, I was gonna ask, are we gonna go back to like survey slash counting with the little clickers for people to get, I don't know, KPIs for our tabling, or from here on out, we're just kind of doing what we're doing?
You can go back to that. It's just the first time that we did the clickers. You need to have someone that's very consistent with it, because when the last time we did the clickers, only 25 clicks were made. And I know that's for a fact that you gave some more than 25, but it's hard to talk to people and then remember to click. So we have to come up with a better system. And I would like to, in the future, collect more data for you all so that it looks good for you. So sitting down with maybe the research team or the policy team,
Yeah.
and just sitting, what do you guys want from your end? What kind of data would help you guys with pushing what you're working on forward? So just basically that. So I think that's something else to come to the retreat with in mind. How would you like to start collecting data? What type of data you would like to collect, and what you plan to do with the data? We need to, and when we start this collection process, we need to be persistent with it. So we're continuously collecting that data, like, it's not just a one event, we need to see so that we can have metrics, so we can say, well, we interacted with 200 people here, but then we interacted here with 400 people. So at the end of the fiscal year, like when you come to an end for that term, you can say, well, HRC interacted with 5,000 people in that time, because those numbers speak volumes, and having the data to back it makes it even better. And it makes getting a request from the mayor and commissioner even easier, because you now have that data that says, this is what the people want, this is what the people said, and if you don't believe me, then here it is.
I would also like to start working way ahead of time for the like content calendar, I guess, for our education sessions, because the healthcare one that we have coming up, which I'll talk about new business, like having that set forward like 3 or 4 months has been phenomenal, instead of waiting until kind of the last minute to get everything together. So if I can figure out what the people want to hear talk about, and like how they get resources, getting those topics ahead of time from the survey would be so much better than me trying to figure it out, or all of us trying to figure it out.
It would definitely be like you all as a committees, like the type of questions to be asked and those type of things that would kind of be up to you all to, first we can help like formulate it a little bit, but as far as what you all want to hear from the community, it'd be up to you all to like what questions to ask and that type of stuff.
Should we try the clickers tomorrow, or?
What occurred to me is maybe one of us, and I don't want to do it, can just do nothing but deal with clicker. I'll just click everybody.
And just watch, yeah.
Instead of passing stuff out and having people, I can be the one that does the clicker, or whoever wants to do it. Okay. That way we're not splitting, trying to.
Right. Because that was the issue, we have a really big one. So that would station you at the table, so every time somebody walks to the table, you just.
So I can't wander and.
Unless you pass the baton down to the next person to do the clicker, but that would be really good,
Okay.
For you all to just get that clicker experience, because I know that in the last 2 events, you probably interacted with probably 5,000 to 10,000 people, because it's just constant, and it's like,
And y'all have it right by the misting and the water right there. And then they come and get the swag, lots of people, and they ask, what are we doing? What does that agency do? What does the group do? And what you just said was a real big boost. I mean, when you say we need those numbers for that purpose, yeah, we need somebody sitting there doing some clicks.
right.
So we can have some numbers.
That's gonna be hard if we're moving very far away from you to keep track.
I mean, near the tables.
Yeah.
So, you know, we're all right there at the tables.
Okay, so we're not walking them up.
Nope.
If you decide to walk off, I do have the finger clickers that you can use, but the only thing I worry about is if, you know, you talk to them there and then they come to the table and talk again, then it's kind of.
I don't mind that.
Soft,
Conversations,
Yeah.
still right. Yeah, still could be valuable information.
but I have all clickers available, and then what I do is I have Dawn's. Not like if everyone else wants to have a clicker, then their account, and then we'll decide based on that number if we need that extra number, but we'll be prepared for those.
So, yeah. That's important. That's important. Quick away.
Okay, anybody else wanna just add to the last couple of events at the table?
I would, and I think this might be helpful to you guys and people in the laundry department, I would like for us to have our own stuff that we take, instead of you guys having to tote our own stuff, then one of us can bring it. And that way, if we're there, we can go ahead and set up and not have to wait for things to come.
And I have those things for you. We just recently went to the store, Cameron did, and bought 2 tables for you all. Those 4 white chairs belong to you all. And also up under my desk, I just haven't opened it because we're about to move. I have you know the yellow and black thing that I roll
Oh, yes.
around? I have you one of those kits that, you basically, the stackables that you can feel, and then I was gonna bring all this to the retreat. But, when at the retreat, you can give me a list or of items that you would like to have in there, like for mine, I have Narcan, I have pens, pencils, things like that. You can just create a list of all the items that you feel like would be essential so that you can ensure that it's a safety kit as well, you know, for your events in case someone gets hurt or you have Narcan in case of an overdose. Those are just the 2 main things that I ask that you have.
Do you have an EpiPen?
No, we just got the Narcan. I mean, if that's what you want, you can request it and I can verify that we can administer with it, but I know that with the Narcan, that's just too, a sport and we're good to go.
Really?
It's really easy. It's just like a nasal spray. You just stick it up and squirt down, and one thing will save 2 lives.
They're teaching in first aid there, blankets.
At the women's resource there, and they were giving it out on the tables. I was just like, this is amazing.
Different world, isn't it?
But I mean, we need it like that.
I was thinking, well, you gave us those nice little Band-Aid things. I don't know. All right.
So yeah, definitely, you guys will have your own items and we will have storage space for you, but you know, if it's better for you all to store, we don't mind handing that responsibility for you, allowing you to store it and stock it. And then if however you choose to stock it, you would just have to bring me back the receipts with the explanation. And, we could do that if that works for you.
Well, I don't want to speak for everyone, but from my perspective and having set up different tables, it would be nice to have our stuff, you know, ourselves, so that we can get everything.
But we definitely got you the rolling kit, we got you the 4 chairs and the, new table, 2 brand new tables.
Thank you.
And to add to what you're saying, Mary, maybe like for any of us who's tabling tomorrow, we could just, if that's possible, collect it from you today or tomorrow early, so that way we already have it. And we don't have to.
Yeah, my husband is on the Peace Scout board, so he went and collected all of their table stuff, and it's in my car right now. But that kind of, you know, that kind of arrangement.
Who will be housing it, or is it just?
I'm thinking it's probably better we just pick up like before events and they still have.
Yeah.
That way someone can't make it to the place.
Yeah, you don't have to figure out where they're at, yeah.
So for whoever's gonna be the setup team, instead of arriving at 2:30, can you arrive around maybe between 1:30 and 2? And then that way we can make sure that you have what you need downstairs, but we're gonna bring it down for you. You know, we was gonna have it out, but
It's right at City Hall.
Right,
too,
so it's nowhere to travel with it, so it'll be smoother.
Mira, why were you thinking that we should have it? Has there been a problem with the lag between when they did
Yes.
stuff and when you were there?
Yes,
But I've never heard
sometimes
of it.
or there are things that are all mixed up, you know, and I'm trying to get where's our stuff, and if we can just keep it separate, then I just think it would be easier. That's my perspective. One person,
Are there labels on top of the bins of like HRC versus people belonging, or like, do you like open it and that's how you know?
We really don't have bins, we have totes that we keep it in that full. And normally because of our spacing at the time is so limited, we have to combine it because we don't have the ability to really have stuff everywhere just for ocean safety reasons. But now that we're moving, just have a little grace with us, we'll have more room to have a section that's just like designated only to HRC, designated only to people belonging, and then, you know, you'll have access to come in and look at what you have and, inventory or make decisions based on that, but just by giving us that time to get moved into the cost of building. And it's gonna be easier once we move, because with all of the activities right there, we're right there, you know, that hill, we don't have to climb.
yes.
So it's gonna get better once we get
Well,
that moving.
I'm grateful that you guys have always brought them out, and I don't want it to sound like.
Yeah.
Oh, no, we
I'm grateful that y'all.
All our meetings will take place there too, so even if like after meeting, you wanted to turn that corner to see what supplies you all have, that'd be an option as well, so.
Alright, so the retreat. For anybody who's not clear, it's July 19th from 12 to 4. What's the name of the building, Anicia?
We said Linden House, I think.
I thought, we're not doing was it Barber Street?
Are we gonna do it there?
That's what we agreed on, was Barber Street.
Barber Street?
Yeah.
It's, I have it reserved, actually.
So where is it?
The Bobby Snipes Water Resource is gonna be, I don't know the thing, but I know it's yeah, it's on Barber Street. It's right beside the poultry,
It's out the what?
the poultry.
Poultry?
The poultry, just thinking
Yeah, just search Bobby Snipes and it should pop up as like Water Resource Center.
Or unroll your window and.
780 the address is 780 Barber Street.
Retreat sounds like it's gonna be like a 2-day thing. You got me all excited. We're gonna go hike together and. First fall. Yeah.
When we get really active, then we'll be able to justify needing that retreat.
Sure.
I'm running late in the year, I think it was amazing, so. That I was like,
Let's call it working session.
yeah.
Yeah, we subjected to that, yeah, when they also did a retreat.
So some of the things we're gonna go over, the current work plan, refreshing everybody's memory just on like bylaws, upcoming events that we have for the rest of the year. We just talked about like our promotional items, so any ideas that anyone has and the resources that, people belonging will bring for us there. And I just added what you just said, Morgan, just speaking about building a plan for next term for education sessions, just so we're just going in it very prepared and maybe even have like, for anyone who definitely knows they're gonna still be very active next year, setting you up with which one would be best for you. So that's some of the things. Oh, and this is like a question slash what I want us to talk about at the retreat. This is a question for people belonging. Are we allowed to like get 1 month where we just don't have anything? Okay, so, because Ms. Dawn, you made a great point, we're still working, it's not a retreat. So at the retreat, right, at the retreat, we're gonna discuss what month we're gonna take off. So, yay, that's what we're gonna do. I know, right, just be like, we're off in August, but
I think the rules, I think it's 10. You all as a commission must meet 10 times, so that's 2 months a year that you can take off.
If we have 2 meetings, like if an emergency session is called, does that count as one of the 10?
Yeah, like if we do 2 in 1 month, no.
Like, 10 in August, I think it's awesome.
That's what I literally have written down here is November, December probably being the best months for us to take off anyway.
So does the retreat count as one of the meetings of the 10, or no, it's like a separate thing?
That is a good question.
That in the special call meeting?
So those don't count.
Yeah.
I feel like the retreats could take place at their July meeting.
If you,
Well,
because it can take place at July meeting and we just conduct it as quorum has to be made. And it doesn't have to, it has to be open to the public, so it has the same stipulations.
Yes.
So regardless, it could count.
But it has to be televised, right?
No.
No, it
It
doesn't.
does not, but.
These meetings don't have to technically be live streamed. It's just a form of communication that we provide to the community. But the meeting, you will have to take minutes, you will have to have an agenda, and quorum has to be met. Those are the.
But it can serve as, and we can, I mean, we don't even have to, it's an issue, we don't even have to call it a retreat. We just call it our meeting.
Or a working session.
Like,
Working sessions better.
God, no, let's keep retreat so when they see all the data later on, we can justify adding activities.
Make it a real issue.
Yeah, let's stick to what it will be in the future.
Oh, I would love to do the parachute exercise.
Okay, so I think that was about it. I know you all are gonna bring, like you said, all the things we already have, extra resources for planning and food.
Yes, and what I'll do is, at the beginning of July, I'll send out, just, guess if you all could just start thinking about where you would like to get the food, what foods you would like, that meets everybody's dietary restriction, and then I can get the order placed in. So if you could handle that, just sitting out, let you guys choose which restaurant you wanna use, and just let me be the person that pays for it. And you can schedule a delivery in. Or we can do a pickup with that, that's great.
Yeah, any dietary restrictions. Okay, any vegan, vegetarian.
I have chicken, so let's just. Oh my God. You know, I love chicken. We could have anything.
It's your maid.
Like a bowl, salad-y.
Yeah, for politically owned
Yeah.
business here, there's like 2 locations.
What is it? What's the name?
M-A-E-O-L-A.
Oh, okay.
And they'll probably serve it like cater style, so you'll probably have like a thing of rice, whatever protein, whatever veggies. I think that's kind
Well,
of.
it's pretty easy stuff, like, instead of doing, like, they definitely cater towards like gluten-free and things like that. Yeah.
Yeah, it's really good. Very fresh poultry.
Definitely not trust it.
Very nice.
Oh my God.
It's so much fun.
I'm like, seriously, cooking.
And it was hot. It wasn't so.
Cooking.
Maybe I can bring some
Church lady cooking.
Right, like the barbecue, the double barrel, like anyway, there was so much catfish, so much.
What kind of ridiculous she realized that she was definitely, I mean, she just doing it from soup to nuts right there. That was amazing. I had to go.
Maybe they'll just send the menu out of your group text and then everybody can, give you what they want and then just create a spreadsheet of what each person wants and then somebody calls an order. And like I said, that takes responsibility on me and, all I have to do is pay. So, and then I'll text y'all, like, we'll text you on what to ask for us to eat.
She's a good guardian to have, isn't she? She's like, what's your budget?
And y'all are good with me? Well, I know it's our meeting, but okay.
It's close by, local.
If it's edible,
Right.
you don't have, I don't have to say what, just give me whatever.
And none of the kids are bringing it to us.
People are waiting to get in on the meeting.
Did it just show?
Gonzalez, if I can get in.
Is that really? It is.
That's well, we're gonna get the fun. I'm not done yet.
Really?
Oh,
We can't hear you. Can you hear us?
Yeah, I've had myself muted. I don't want to like. Good evening, everybody.
That's William. He's our one of the new members.
Nice to meet you. Nice to meet y'all
you saw
virtually.
the person that's there. She,
I'll brief her on. We'll be in contact.
I have a question. Yes. Slightly off topic, but not. I know we had talked about updating our website in the past. From y'all's experience or perspective, how, I guess, big of a program should we make that? Should it be like on the agenda for retreat or just something to fix by the end of the year?
If that's something you want to talk about. Well, see, Evelyn won't be there, so she would be the one that handles that, so maybe can we move back to a meeting that she can structure that would be her expectation.
Email, put me more than everyone in the email, and we can look at the next meeting for guaranteed.
We've been working on resource tabs, especially with all these people from the education session.
Send a reminder.
Most likely August, but hopefully.
We should have fresh pictures and everything, and if you have a vision for a website, that might be good to.
Yeah, if you want to start sending me ideas, by all means, just know we're working under some like, it's a hard to use Civic Plus and there are some restrictions on like what we can and cannot, like, yeah. So if you have some ideas, I can add it to you. So yes, or unfortunately, that's.
Corey mentioned to me this week about taking his pictures at the retreat since he wasn't able to come to this meeting. Will that be possible?
yeah, I'll take it.
Okay.
And if anybody wants to update theirs, then they can.
Okay. And also, it won't just be work, guys. I'm thinking we do need to do like a team building exercise or get to know type game questions. So that'll be there.
I have some too, if you want me to.
Yeah.
Fifty.
Can you just send a camera?
I mean, I'm gonna be there, but
Oh, they're included. If y'all didn't know, y'all are included, because we need to get to know you all more. So yes. So it'll be, not stress. It's not very. It's not a choice. I mean. Okay, so that's the retreat, guys. I'm really excited about, doing that next month. Any public comment on new business? No? All right, so all we've got this week or this month is the healthcare session marketing. Take it away, Morgan.
Okay, so we have everything done as far as panelists. I will go ahead and read them out. Dr. Loretta Dugan from Her Health is the moderator. Dr. Cole Phillips from Mercy Health Center, they offer free healthcare to low-income people in the community. He will be talking. Haven't gotten a name yet for the Feminist Center for Reproductive Liberation. They're out of Atlanta, but they're going to send someone to speak. Ray Roberts from the East Georgia Cancer Coalition. They hit on a lot of reproductive health as well, so they're kind of backing that up. Dr. Susan Lester and Jen Brown from the Athens Free Clinic. It's a UGA and Augusta University, the nurses clinic. It's a medical partnership, so I really wanted the UGA representation there as well. They go around and offer free healthcare like locally. So they're coming. And lastly, thanks to Ms. Dawn, Dr. Daphne Blackburn, and I believe we're going to use her representation from the Athens Neighborhood Health Center. So fully staffed, very excited. I sent that information to Evelyn today, so we're getting like the marketing piece together. What I would like to do, since it's a little bit over a month and a half away, schedule a call with everyone, and they're all for it. They said they would, just to kind of introduce everyone, get a couple of questions together, understand what we want to really talk about. Luckily, Dr. Dugan is just a great talker. She's in healthcare. She can hold her own, so I don't need to ask any questions anymore. So it should be pretty self-sufficient. The other thing I wanted to bring up, kind of talking about tabling, which I guess we can talk in the retreat. They wanted to bring some of their materials to table, because the whole point is to get access to the community. So I don't know, I need to ask them in the call if they're also gonna bring like giveaway, like, you know, the swag stuff for their table. If we offer some things, I want it to be kind of healthcare related as well. If anyone has any opinions on what that should be, I can go ahead and kind of mention it when we do the call and see if I can bounce any ideas from them as well.
Wonderful.
I haven't scheduled it yet.
We're not on the call,
If you want to be, you can, certainly, yeah. If anyone wants to be, certainly can.
And if you think ideas about what it should be, I mean, what they should bring with them to put on the table?
For hours, they're bringing like education materials, their cards, they have little like stress balls and like healthcare packs, first aid packs and stuff, so they have their own that they're bringing. And they asked us what we're going to provide, and I was like, we have a meeting on Wednesday, I will ask.
chairs.
Yeah.
What do you mean, what are you gonna provide? Provide for the table or?
Provide for our table, yeah, so HRC materials,
What's that?
because we're hosting it.
Why do they care what we provide for their table?
Asking about
So they asked, they're gonna have a speaker there to speak on something. They're like, do you want us to bring someone to table too, so that we can provide information to the community? I said, that would be great, because the whole point is to get access to the community members who might come to their session. So they're gonna bring someone to table for them and a speaker, so they can have that double access point. We also table at all of our talking events, our education sessions. So we will be there, like Brandon did the affordable housing one. We'll have a table there with HRC stuff as well, because we're hosting the event. People want to know who put it on. So we'll have our documents there, little postcards and stuff. I would also like to have little giveaway things like we do at our tabling events for healthcare related. So we can kind of match what they're doing.
So we'll have time at the retreat, and I think we'll have time like turn around to possibly get people belonging to the order in.
Yes,
For
it
that.
should be.
Because we should probably, when we're looking at the work plan, probably look at what all our things are and then get our promotional items based off of all said topics we're trying to hit.
Yeah.
That way, we're just ready to go for the next year.
I have a suggestion.
Mhm.
Tote bags work really well, and I think it'd be really, like, people can carry, like, that's something they use a lot, right? So, and then while they're there, they can stack those totes. And then you could even do like a craft section, and they could like personalize their tote. As like an extra, they can make a charm for their tote bag, and like y'all can connect with people that way. So that's my suggestion.
They're so good.
Get the Band-Aid things.
Yes.
Oh, yeah.
Yeah, that's really cute, because I do want, if there's people who are gonna be talking on like childcare and child healthcare as well, so I do want it to be like a family kind of event, to come get the education. So yeah, that'd be good. It's a good idea.
Y'all wanna start working on options?
Some things for children too.
If they're gonna bring kids, and yeah, it's a library. Well, it's like, yeah.
Because if they can grasp it, then we don't have to necessarily get.
One to the the library, this is like regional library, like, they find media for
Adults in the same time, wondering what's going on.
that's at the call.
Okay, so that's probably what the story is.
Yes.
They're right.
The Mercy Health Center, a lot of the work they do is behavioral health.
Every single one.
All of us.
They have been so hard to get in touch with.
But like medical design and stuff, yeah. They're like, you gotta know somebody who's there and then they'll introduce you. They're one of those.
That's what I've been trying to fundraise some dollars for, is the Halloween campus.
Yeah.
We're then, like, but to get email blockers, whatever, like, I can't, like, even when I've gotten like a friend that works there, like, oh, you should email this person, I email them, and then nothing happens, and I'm like, oh, I think they blocked.
Two of these people and one who was going to be on at the cottage, but they had a thing going on that weekend, so they couldn't have a speaker. I saw them try, they had a booth, and I was like, I sent you guys an email, and they're like,
You
oh,
totally missed me.
right. Yeah, so that's how I got them to respond in a lot of it.
Do you need like a backup person for mental health, or you just gonna keep trying to receive? Who's your team again? Last month we gave you.
Oh, Mary,
But I am over here.
Shamir.
Corey,
I remember. You had like 3 or 4 people.
Yeah.
Sherry was on that list.
Sherry. I know we went like this.
I can't remember if it was your
But,
regular.
but I can definitely help.
Okay. I will take any.
So you
But
said,
Nicole, I will reach out to you. When I have a call with these doctors and I kind of talk about, we really want to get into mental health, I will see if they're like, we don't want to, but like, if they don't, I'll get a healthcare person from you.
Sure. Maybe we can, you guys can start thinking about what team you would like to have William on. What team he might be interested in being on.
Oh, we can ask them.
When you say what team,
yeah, like the
So like we have
summer
like your engagement team, your policy team.
at the retreat?
So,
God, yeah. We've been doing it really bad. Or, well, it kind of got mixed up. We did have like people who were on engagement and blah, 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 blah. We ended up with a lot on engagement. Then all these events came up and then it was just like whoever's willing to table. So that'll also, it's a lot of things. We might actually use a lot of that time, July 19th.
I just like that.
I want us to all just get on the same page, even though it's not like we're not on the same page, but there's been a lot of moving parts and things happening, and I don't feel like we all know what's going on all at once. So it's true. Yeah. But that's, yeah, the healthcare.
Cameron, is this the comment on new business? That we just, so Cameron and Evelyn and I met regarding the menstrual policy proposal. Is it announcements or here?
It will be announcements.
Oh, wait, but it has to do with health, the health.
It does, but no business is like specifically the healthcare session, but it can go on an announcement. Because that would have to be put into the legal.
Are you still working? You've got a team of 4, including Corey, and that's the one that's not here. So boom, that runs on healthcare announcements.
So when we met, Cameron and Evelyn and I met to just kind of start finalizing the proposal that we're gonna bring to the meeting, and then hopefully mayor and commission October meeting. Because, well, now that July is counting, we could vote on it in July. If we have it, and then it could make the August meeting. Is that right timeline? Maybe. If not, October is when we present to mayor and commission. But at the meeting, we were just going through everything, and we had this idea that at the health fair, we could promote the policy proposal and also talk about, there's a lot of cities that are doing like menstrual product fundraising. You know how like Thanksgiving, you do like the canned soup or diapers and things like that. We thought maybe we could make it a fundraiser to collect products for the people that may need more than just like an emergency or while they're in a restroom.
For the period that we are trying it out.
So like collect products to go into the machines or?
No, just to collect products, like if somebody, because on our materials, hopefully we'll say, well, if you have, like if this is a consistent issue that you're running out of menstrual products, you know, you could go to HRC office and maybe get pads or tampons that you're using.
So using the healthcare session to promote that.
Yeah, and like maybe we could do it as a fundraiser, like it could be an HRC initiative to collect Cause we don't have anywhere in Athens that collects those products for people that might need more than when they're in the restroom or one or two.
Oh, so you're talking about donating the
Yeah,
products?
we can have like a
Kind of
Toronto.
like the diaper bank does.
Yeah, I like that.
Well, if you're trying to have it for the healthcare event, then yeah, we'd have to put it on the agenda for the retreat. Do we have room to store this if we did it?
So what,
These period products?
we probably could store them somewhere, possibly in our facility. to Get those, but we would figure it out if people started to donate them. Because I think that honestly, the donation fundraising type is going to be, and I think time is very important when you present this to mayor commission. Because like, if you present it now while they're fighting about budget and affordable housing and all of that, they're gonna say, they're gonna shoot it down. They're gonna say, we have bigger issues, so let things calm down right now with them, so that they're on the same page. And then go ask them for money, but looking at us going and being in a $3 million deficit already. So that's just something, I don't want to stop your process, but that's just something to consider.
Smart.
Yeah.
Yeah, but we could also like allocate it to like HRC, like we talked about the Department of Health could be a place you could go get. Like wherever, like we could have a few locations where you can go get the products. We thought Department of Health was a good option, our office, and then maybe the library on Baxter Street.
What you're saying as far as like proposing it to
Right.
mayor and commission right now, we should probably wait.
I mean, it's completely up to you all because.
I mean, you're not talking about collecting stuff, you're talking
The
about
program,
financing.
the program, yeah. But I mean, if you're having a place where people are donating, they're gonna be all for that, but if they feel like they have to put out some costs, 9 times out of 10, they're gonna raise, you're gonna have a lot of data to back it to prove why we need it and the benefits of it, things of that nature, because they're gonna definitely wanna see, it's gonna be hard to get it approved when we're fighting for affordable housing right now.
So would it be smart then to forward with like the donation process at our health care session and kind of keep that as like what we're doing, with the community, and then wait and in the back end, working on the proposal to present at a later time when things cool off?
I think the donation part would be good.
Okay, so we can start fundraising, I guess, collecting. It would be the more appropriate term, but I think like going ahead and finishing out the proposal and having it. We don't have to present it, but we can have it approved and.
Yeah, definitely. I mean, and if
Yeah.
you're ready, if you feel confident about submitting it to them, go ahead.
Yeah, I understand what you're saying, but I'm just like, we're very close to getting it done, so we could just get it done and have it. And like, put it on the agenda for later, once the budgeting is, we have a clearer picture on it.
I don't know if there are rules about it, but you may want to think about schools as a collection point. They're already there. If we could just give a box or something. There may have to be some box, just.
Yeah, it's just an idea of a way to, because Athens doesn't have, like Evelyn looked it up when we met, and there's like a lot of cities that have, they collect the products. People can, basically the way the diaper bank is set up, and then you can go and get some when you need it. So we thought this would be a good initiative for us to do something that's.
So what we'll do is, it'll be on as far as the donation, it'll be on the agenda for the retreat. And you can headline how you want to, where we're going to have these like drop boxes.
Yeah.
Cause I know a lot of organizations do that, but you usually have to get in contact with that business or that organization, and they'll allow you to put whatever there because they're all for it. So you can headline that, so that part will be on the retreat. And then as far as the actual proposal, we'll probably look at August, September.
And I recommend like reaching out to all the places that we would like to have the drop boxes or whatever before the retreat, just to get an idea of like how it, like logistics at those different sites, so we can figure out. Because you guys send drop boxes, I was thinking of, oh, like, what if we like had them there, like we, you know, people donate and then we have a location like at the schools where we give it to the schools. Like I wasn't thinking about.
Yeah, that's what I was like, at the fair, we could have a big fundraiser, like there.
That's a healthcare, that's a healthcare. I know it's free event, maybe that can be like donate menstrual products, kind of like.
By doing that, that's building your data.
Yeah.
That data that they want to see, that's what's gonna build it, seeing that if the community can come together and provide this, why can't you all? Can you meet us halfway? You know, the community has done this much, what can you do at this point? You know, you gotta have a really strong tactic to sell it to them, because with affordable housing, that's a big fight, you know, so like, this is something you need to be able to show them, this is something we need. You know, because that's what our commission is kind of on, we need basis, you know, and you just want that, and so many people want different things, so many organizations, and as you probably, if you watch the meetings, they just had all these fights about funding and what nonprofits didn't get funded, what nonprofits did get funded, and why so much and why not enough for this one, so you want to make sure that this is sufficient, so if they do fund it, then they don't feel like, oh, well, I'm gonna have to answer why I funded this and why I didn't fund that. So just having everything covered with them, just.
Yeah, and that was my idea, was like, we collect and then we take it to places that the community can go to get it.
How we advertise that folks know that we're collecting.
I would put on the healthcare marketing challenge, like free event recommended donation, like menstrual products or.
That's a good idea.
Yeah.
And like, we'll have a big box or something, they can just drop it in and say.
I do have to check with the library, because everything they do goes through like their PR person, which should be fine. Everything has to be free there.
Yeah.
So I don't think that's a problem as a recommended donation.
They do canned food and library.
Yeah, so I don't think that's a problem, but I will check with them first too.
And look at like, for all of our contacts outside of like the government stuff, look at any businesses that you're friendly with, comfortable with, that, you know, obviously it's like appropriate for their business, for us to have a drop box. Because the more locations, the better, and we can do a count at the, however long we have a month, we do a count of everything we collected, so we can give that back as our data.
Pink Goblin.
Yeah,
Definitely would.
yes. I know most of the like women-led businesses in Athens will be team donation box for this. So yeah, reach out. That's why I said like, please headline it, put it in the group chat, like any ideas you have for us to execute and help.
And we're gonna be collecting this stuff before the proposal, so that the proposal looks better. Okay.
Is like the product.
It's under $10,000. And there's already been like a budget, like a bucket of funds have been earmarked that it could possibly come from, so.
Okay.
But I know the data will fit it, because like you were saying, it's just so much going on, so we're definitely gonna need it.
In worst case, if it doesn't get approved, or like, while we're waiting for an official approval and like official proposal, we could do the bins, like, you know, just have the little containers with the products we've collected.
And if you take it to them and they don't approve it, then they'll have to give you a reason why. And that when you can build off of that reason, correct that, and then just say, go back again. Cause they deny us, it's completely out of the window. It's just that they deny us, okay, let's correct this, and then let's go back and present the idea to them. And that maybe, you know, what happens in the beginning is denied, and then they'll give you your reason why they denied it, and then you say, well, I'll go back and fix this, and they say, you know, go find additional funding.
Would it be a good number to have, like calculating how many boxes of what and like what that estimate cost is for each, adding it up to be like, well, the community brought in like $15,000 worth of boxes and packs, like, if we run that.
That would help, that's numbers, any kind of data. but definitely, it's just, you know.
And I also think, going back to what you said, Nicole, who we give it to, I think the high schools, the middle schools, and even like, if there's a way for us to give back to like the homeless population, so that they can see like the community came together and helped. I would really like, and I know you probably wouldn't like this, but I'd really like to see us push it all the way into holiday season. Because if we can collect as much as we can, and then we give it and we say, hey, these are people, they're now on their off season from school, or it's cold, and the community came and gave this great resource. It makes it very hard for them to say no to that.
Well, just because we present maybe in like September, October, doesn't mean we can stop the drive. We can
Yeah, I
do it with the season.
The way we talked about this was like this, if it worked and everybody liked it, can be like an HRC thing, like this is an initiative that HRC, even when we're gone or whatever, it's like a thing that HRC does.
I think we definitely should make it our thing. I'm more so, as far as the proposal, I think it would round it out better if we not only have the numbers of how much was collected, but who it was given to. To do the proposal before giving it out, it's not that it still looked good, but it looked way better and a lot harder for them to deny. If you have community people like, man, if they're not gonna support this, and this really helped me out during the holidays.
Yeah.
So you're saying wait until like the end of the year to get the
Yeah.
proposal?
Yeah, to really like, yeah. Because with affordable housing really being like so important, it's so easy for them to find any reason. It
We
needs to
don't
be
free
so perfect.
pilot.
Yeah. I remember the official pilot.
Yeah, so we're giving this away.
Soft launch.
It's been
But
used.
our numbers too will probably jump, because if we're adding businesses, holiday time is when they usually do a lot of their giving. So we could probably see like a skyrocket right before.
I mean, I think that, this is just my opinion, at Christmas time, people aren't gonna be wanting to think about or talk about periods. Not because that's incorrect,
They don't go away.
that they don't. That's to be true, but I just think that holidays, people are gonna be thinking about other things. And if we're not having a meeting in November or December anyway, if we're not having those meetings, didn't we talk about not having a meeting in November, December?
Yeah, that's gonna be a part of the retreat.
Okay. Yeah, I just don't, that's just my feeling about pushing it to the holidays is,
But we're starting it at the health fair.
so what part are we pushing to the holidays?
I think the proposed for after the holidays.
Well, we're gonna do, I'm thinking doing the donation all the way right at the holiday time, and then proposing right after we've collected everything. And
So we're not gonna start giving it out until we've collected it?
I mean, we can, we just would have to come up with the numbers.
Yeah.
Exactly.
Anything
That too, yeah, if it's like September,
So, yeah, keep good records.
yeah.
You know, you could just as easily say it's holiday time, so people feel more to give.
Yeah.
They feel more, charitable.
Nobody ever wants to think about periods.
You know, you do like everybody else, like, you're like, this is a serious issue, women have this every month, and it's not cheap. Especially if you have a red tax,
If you're thinking like,
or home tax, whatever.
taxes in the winter time, where everything's already hard enough, like having those products available for the homeless community would be like just an extra little push on it, I think.
That's my opinion, I really feel like it'll actually go through if we have all of it at one time, instead of trying to propose it and then come back later and say, oh, we did this and we did that, like,
Reactive.
yeah.
And it gives you, just allows you to see the success and see, get that community support and then see, you know, is this gonna work? Well, is this gonna work before we actually go into buying dispensers and putting them here and there, you know? It's that trial, and it's a free trial. So it says to the commissioners, well, we went out here and we recruited these businesses to actually participate, and they donated the product, you know. This shows that this is needed, this is supported, you know, it just gives you that extra cushion. So even if they don't agree with it, they're forced to agree with it because they know it's something that you guys started, it's something that you guys focused on and pushed through, and it's something that the community supported. I mean, how can you deny it? if you can get that community support. Yeah, and I think that if we get the donation part going quicker, then I could foresee us, like, with our new building, we can buy, the dispenser, and we can start out as being their first trial. I think our budget would be fine to be that first set of trials for businesses, you know, even if they don't, ACC Gov says, well, I don't wanna do that, then we can be the start of it and see how much we give out. You know, say, well, People in Belonging had a dispenser and they were giving out 10 pads every week, you know, and people were coming here and utilizing the availability of these items, you know. So maybe if we shrunk from having 10 pilot locations to maybe 2 or 3, we could possibly move a little faster if we did that than versus trying to do 10.
Pump up the numbers.
This is an idea from.
And the thing about it, to do 10.
Well, we could start with the health fair and start collecting products, see where we are to retreat.
Yeah, that's
How we're doing.
Well,
Then we'll go
yeah.
from there.
And I do want us, like, just to, unless anyone has any other announcements, just to kind of close it out. First, to always just remember that we're here for our community. I know this being related to government, we're always like, oh, how can we like push a subject to maybe mayor and commission or an idea or concept, whatever. But having the community have our back first before we go that route is always gonna be a win for us. So anytime, like the data does matter, because if it gets taken away, or if for whatever reason our resources is taken away, we can't do something, we have so much backing us. It's not just the people in this room fighting for something. So I just always want us to keep that in mind, that that's our numbers, is keeping them informed and giving them what they're asking. Any other announcements? Okay, motion to adjourn the meeting.
So moved.
Proceed to
You're shy.